There's another option for folks suffering a blockage of the carotid artery. That's the artery in the neck that supplies blood to the brain. As you can imagine, a blockage there is a critical situation, and that's why this stenting procedure is proving to be a real lifesaver.
This summer, Bob Powers is storing away his skis, happily looking forward to next season. Just 2 months ago, he thought he would have to leave his active lifestyle behind when doctors found a blockage in his right carotid artery.
When I got up in the morning, I was sitting reading the paper, and I hadn't paid too much attention, and all of a sudden I noticed that I could not make my left hand into a fist. And then a few minutes later, my left arm started to tingle.
Bob called his doctor at the first sign of trouble.
Originally, they thought it was going to be polio syndrome because I had polio at a very young age, and my left arm was affected by that.
Bob's doctor sent him to interventional cardiologist Dr. Rohit Sundrani, who found the problem.
All the blockages don't need to be fixed. The blockages which are causing the problem need to be fixed.
Carotid artery stenting is an alternate treatment when doctors feel standard surgical treatment is too risky. Patients with significant heart or lung disease or conditions that make it difficult to tolerate general anesthesia may want to consider a stent. Other considerations are blockages on both sides of the carotid artery and previous surgeries or radiation treatment to the neck.
Well, I think for those patients that this is the only option we have.
Dr. Sundrani is trained and experienced in this new procedure. He works with a team of doctors at the Fresno Heart Hospital. They decide together who is a good candidate for a stent.
We have a consensus of the people here. So if you see a vascular surgeon at the heart hospital or you see a radiologist at the heart hospital, if they think this is what they need, this is what they would get.
Scar tissue from previous cancer surgery, radiation treatment, and a 90% blockage made Bob a good candidate.
So this is Mr. Powers' picture before we did the procedure. This is what was causing his stroke-like symptoms. This is the other shot. You can see that whole area is covered with a stent now, and looks great.
To place the stent, Dr. Sundrani navigates a catheter through the arteries from the patient's groin up into the neck, or carotid artery. He then balloons the artery and places the stent. The stent pushes open the artery and holds the built-up plaque against the artery's wall. This prevents the plaque from traveling to the brain, where it could cause a stroke.
There you go. Take a deep breath. Hold it. Do not breathe and do not move.
Patients are awake during the procedure.
You want patient to follow your commands. And if you give a little medicine to make them sleepy, they'll be sleeping, dozing off, and you would not know while you're working in the artery whether you have caused an embolic or an emboli to go to the brain and cause a small stroke or a major stroke.
Dr. Sundrani says the stent will probably never replace the surgery. It just gives doctors a second option to consider for their patients. As for Bob, he says it was an option that probably saved his life.
I'm very, very fortunate that they caught this at the time, because I was right on the edge of either having a massive stroke or dying from it.
After getting the stent, Bob was able to get in one last run before the snow melted. And until next season opens, you'll find him working out in his wood shop with this advice for others.
Don't be afraid, because it can only save your life. And I feel like that's exactly what it did for me.
Words of wisdom from a man who's had the life experience to know. Patients receiving a stent must stay overnight at the hospital and are asked to take it easy for the next few days.